fresh seat from this, and then we would fold this in the middle like this. And put it like that here. And then the chair alarm goes under there. We don't have a chair alarm, and then one like a chuck pad, a smaller chuck pad in here.
And you're moving them to the chair to be more roused. So getting a pillow perfectly behind their bed is not your focus. If it's uncomfortable, you can put a pillow behind their head.
Yeah.
But you're not trying to make them comfortable enough to go to sleep in the chair.
Yeah.
You're getting them in the chair so they're more alert, getting more stimuli.
So we said already you're going to look at that and then, decide some of the lab values. She said, if you're not, you always especially in acute care, in ICU, you always talk with the nurse, like Dr. Ingram said, before, are they stable enough for me to see? She'll say that they are, but just watch their oxygen, or watch their heart rate, don't let it go beyond this. Usually in we have something which says do not go beyond.
What's the normal respirations?
12 to 20.
So there's a little elevated. Yeah, so those are the only three that will be on there.
Yeah.
It's gonna be the heart rate, pulse oximetry, and respiration.
Yeah, so those
And blood
three,
pressure.
we are looking.
Four, I'm sorry.
Hannah showed the map. I think that's a little too high level for you all, so we won't have you do the map and the arterial blood pressure and all that. So the things that you have seen that patient is stable, and then you come and you're getting ready to transfer. Which are the lines you can take off safely?
Blood pressure.
So the blood pressure, usually I leave it on, the cuff I leave it on. We don't have the attachment here, but you can take the cuff off. But usually I'll leave that on, unhook it from there. But yeah, this can be taken off. What about the pulse ox?
If they're stable.
If you want to monitor it, but you use it often, okay? But this comes in the way.
Based on those numbers, would you get comfortable with taking it off today?
Yeah.
Especially
about-
if she's not getting any. If she's getting supplemental oxygen, it could be lower than that, and you may
Yeah.
also.
What about this one? Can you take that off?
Well, not if we don't transfer, but she might need her oxygen.
Yeah, she will. You don't take this off. Leave it. Even if it is when you came in there, it was in the nose. Leave it on. Do not say like, oh, they are at 94. I'm just going to take it off. They can drop real quick. Okay. So these. What about these?
Yes.
You can. Okay. You can take this off. This is attached. Usually, I'll just unhook this and leave that because that's the IVCC duty. Either this or that. What about the catheter? No. What about the wound vac?
No.
What about the wound vac? No. And what about the restraints? Yeah, you do want to take that off, but usually if they are bilateral restraints, if I'm working with them, I'll take this one off and have my hand here if they are really moving around to pull their lines. Okay. What about the straight collar? No, you don't take that off. Heart monitor? No. And chest tube? You cannot take the chest tube out. It's like way, I know I put it there, it's way at the side of her and it goes inside the lungs. That's when they have that consolidated pneumonia where it's gone between the beehive kind of thing. The chest tube goes in there and it fills up. You can ambulate them with that, you can have them get up and walk with it. Okay. And the wound vac, we don't take that off either. So what do you want them to do next? Just to